Hello and welcome back. It is part 3 of chapter 4, sensory function. We are getting there. So let's go over some nice clinical stuff. And I think a lot of this may look familiar to you guys, kind of bread and butter stuff that you deal with often. So let's start off with general knowledge of it. We can have an alteration that will result in a sensory perception, and we have alterations that may result in a risk for injury. And what I mean by that is, for example, uncontrolled glaucoma. If we have glaucoma, and that's one of the first things on the list here, if you don't remember the exact description of glaucoma, can put pressure on your optic nerve, which can lead to blindness. So congenital sensory disorders, two simple things we're going to go over here. Eyes and ears. With the eyes, we can actually have congenital cataracts. This is one thing that I've actually learned from this book that I did not know. This happens with Down syndrome. It's right in the next set of notes. I also wanted to pop myopia in there. Myopia is when you are farsighted, nearsighted. Sorry, presbyopia is farsighted. That's my mistake. So people who have myopia can't see far. For example, if I take off my glasses, forget it. I can't see, signs that are in front of me, but I can see up near. So nearsightedness. Presbyopia, which is on the next slide, is farsighted, people who have difficulty seeing near. Ears. We can have an absence or malfunction of the external ear. We can have, also congenital loss of hearing due to multiple reasons. And we'll go into loss of hearing in general. Congenital cataracts. And like I said, we see this with people with Down syndrome. It's the lens of the eye, not the cornea, will get cloudy, and it causes difficulty or haziness with vision. This is the same thing with cataracts in elderly. What happens in people who have cataracts as they get older is there's actual damage to the lens itself, but they do replacements of those lenses all the time. And the great thing with that now is they can also correct your vision. So not that I'm looking forward to cataracts, but I do look forward to maybe eventually getting lens implants, because I feel like it's pretty safe. They've been doing it for so long. So congenital ear conditions, talking about the external ear, you can have an absence of that auricle. It can be underdeveloped or small, or you can actually have a lack of an external ear canal, which is called atresia. So these conditions are more common in males, but they usually will be present with other congenital problems. So there might be hemifacial microsomia, which will be a small development of the face. So for some reason, as that baby started to develop, they had a lack of development on the side of the face and the ear. And they may actually, you can look it up online, be missing an ear canal. Could be unilateral, could be bilateral. Obviously, they would have a lack of hearing due to it, and this may be due to maternal rubella, which we used to know as German measles, and possibly syphilis infection during pregnancy. Sensory conditions with aging continued. The eyes just become less sensitive. You know that. For all you young people in this class, you will see when you get into your 40s, even late 30s, you just don't see as well as you used to. I feel like an old lady sometimes. I'm like, oh, well, I can't drive at night because I can't see as well, and I just can't. I mean, I hate to admit it. Pretty healthy otherwise, but the eyes don't work as well. Also, prescriptions may get worse as you get older, and you may become presbyopic or have presbyopia, which is farsightedness because the lens ages, so it's not as pliable, so you can't see up close. The old arms quite aren't as long as they should be in order to see things up close. But once again, they're doing amazing things with lens implants where they can actually correct near and farsightedness, which blows my mind. Hopefully they have that perfected in 5 years, because I may be headed that way. Here's a list of eye changes. I think most of this you know already. Tear production, structural deteriorations, corneas become less sensitive, pupil response is slower, the lens will become cloudy and yellow, Fat pads that support the eye. There's a little fat pad behind the eye because the eye obviously is kind of jelly structure, if you've ever done that cow dissection, and there's actually a fat pad right behind it to support it in the bony skull. That can actually deteriorate, and you'll see people as they get elderly, their eyes seem to sink back into their skull. The extraocular eye muscles will weaken and they can't move the eyes as well, and we already know about visual acuity going downhill, unfortunately. Ears will thicken with aging, the actual structure of it. But the other thing that can happen with aging is, so hearing may decline slightly. And if you remember, we talked briefly in the cochlea, we have the organ of Corti that has the hair cells that get stimulated. They're little hair-like structures, I shouldn't say they're hair cells, with different frequency noises. Those little hair-like structures in the ear can get damaged with age and or destroyed, so you just don't hear as well. You can also have that what's called otosclerosis. I think I mentioned it earlier. If not, it's further in the notes. You can actually get those three little bones of the ear, middle ear that we spoke about earlier, can actually start to fuse together. So you can decrease hearing ability that way. This will be accelerated in people who are exposed to a lot of noise. I had a friend in chiropractic school who used to blast hard rock music when he was on the lawnmower, and he ended up with hearing aids by the time we were in our 20s when we were there. Smoking is just so damaging as well and can cause damage to the ears. So wax, we probably see that a fair amount. That can decrease your ability to hear, and it's more common with increasing age. So, and of course I put the cart in front of the horse. So sensory neural hearing will be damaged somewhere along that nerve pathway. So that'll be from the vestibular cochlear nerve through to the brain. So, and that'll actually include the inside of the organ of Corti, because the nerve goes in there, and those little hair receptors are actually nerve receptors. So sensory neural will be the decreased sensation in the nerve pathway. Okay, so anyway, we're from the organ of Corti to the brain. Conductive hearing loss is when you'll have damage to those little inner ear bones that bang up against the window that goes into the organ of Corti. If you don't remember that, you can go back to that picture that I showed you. And tinnitus or tinnitus, it's actually said either way, believe it or not, is common, and that's ringing in the ear. And they're not 100% sure how tinnitus comes about, but with aging, the ringing in the ear, they think that it may be an exaggerated response to loss of hearing, your body trying to hear more. Could be some damage to those nerve cells that causes a stimulation. Like I said, they're not quite sure why that happens. And that, my friends, bring us to question time. Congenital cataracts are seen in people with Down syndrome. Please pause the tape, answer it, and let's move on. So infectious and inflammatory sensory disorders. We're going to talk about bread and butter conjunctivitis and keratitis. We'll also talk about bread and butter otitis media, otitis externa. I'm going to kind of quickly go through these because I think you know probably most of them. So conjunctivitis, oh, the pictures of this just skeeve me. So you all know what it looks like. It's going to be an inflammation of that conjunctiva, and that's the mucous membrane that is on the white of the eye, which is the sclera, and then reflects on the inner lining of the eyelids. Can be caused by a virus, can be caused by bacteria, most common staph, can be caused by allergens or chemical irritants and trauma. So you get a blurry vision, photophobia, watery exudate, a yellowy green exudate can actually be produced. And I found out the hard way that if you use eye drops to decrease the redness, it makes it exudate a lot worse. I had a meeting and I had conjunctivitis and I put Visine red drops in my eyes, and yeah, don't ever do that. Okay, so we went through the causes, risk factors too. I left in here because you can't wear your contact lenses, and you know this. I'm just putting it all down on paper for you. You can't wear contact lenses after you have this infection. You got to throw away your makeup, and you know, if you have eye drops that you've put in that aren't to treat the conjunctivitis, you're gonna have to throw those out and get new ones because you may have infected it. Could be bacterial, could be viral. We all know it's super highly contagious, especially if we treat kids and or have kids. So keratitis is going to be an inflammation of the cornea. This actually can come from herpes type 1, can be self-transmitted from the mouth and cause an ulceration on the cornea. So this inflammation and infection goes to the cornea, just to be specific about those differentiations. All the manifestations are what you would think, you know, sensitivity to light, pain, visual disturbances, because they can't see through the cornea. And even though it's not the lens, it'll cover where we, you know, pass light and rays through for vision. Otitis media, you got this one, right? Infection or inflammation in the middle ear. Common in children, just as a sidebar to remind you, children's ears are narrower, straighter, and actually shorter and horizontal. So because they're more horizontal than adults, it's difficult for them to drain. And those eustachian or auditory tubes drain into the nasopharynx. So if you could just imagine them being straighter, it's harder for them to drain when that child's upright. So they can get fluid in the middle ear. It can lead to adenoid enlargement, which is the lymphoid tissue in the back of the throat. Immature immune system can also I backed up there, but I should point that out. An immature immune system can also contribute towards these. So this is usually going to be as a byproduct from an inflammation from an upper respiratory infection. And even though it starts as viral, it can actually cause an accumulation of fluid in the back of the nose, which can go up those auditory tubes and into the ears. The other thing is, when you get a viral infection, it can somewhat damage the epithelium or the cells lining any of the tubes that are open to the external environment, and it causes a more hospitable environment for bacteria to set in. So even though it's starting as viral, that viral infection can allow a bacterial infection to set in, and you get into that crazy cycle of sickness and ear infections. So we see this in childcare, right? Kids catch this stuff so much. I look at little kids in kindergarten or preschool, you know, they, first of all, don't wash their hands. Second of all, put everything in their mouth, you know, so they're more prone to get these infections. Feeding infants in a supine position so their ears can't drain. Smoke exposure, it blows my mind when people smoke around kids. My husband always yells at me because I yell at people who smoke with their kids in the car. He's like, they're going to beat you up someday. Oh, it drives me nuts. Don't do that, though. I don't recommend it because I don't want somebody to get mad at you. And a history of allergic rhinitis can also increase the risk factors of this. You know, some kids seem to be prone to this. So can lead to a rupture of the tympanic membrane, which can lead to tubes, can have scar tissue in there, conductive hearing loss, because infections can decrease the ability of those three little ear bones functioning, and it can lead to mastoiditis. If you don't remember what a mastoid is, I'm sure you do, but it's behind the ear. It's a little projection down of the temporal aspect of the skull, and if the infection gets too bad, it can indeed go into that skull, and that is bad news. We don't want that to happen. Manifestations, poor little peanuts get ear pain, they cry, they pull. That was my boys. Thank goodness they didn't have a lot of ear infections. They would pull at the ear and rub the ear, and they're just so uncomfortable. And you may see a little exudate come out of the ear canal if it's progressed enough. Now, in addition to otitis media, we have otitis externa, which is exactly what you would think. It's going to be infection of the external ear. Usually bacterial, can also be fungal, can arise from moisture that can create that hospitable environment once again for bacteria or fungal growth, getting there from external sources. So swimming in infected water, scratching the ear, sticking things in the ear. Once again, we mentioned that kids love to stick stuff in their ears for who knows whatever reason. Now, this can lead to hearing loss, cellulitis, necrosis, osteomyelitis, which is going to be the infection of that bone once again, and meningitis if it actually gets into the bone and into the meninges. If it gets into the middle ear, can also come in. I've heard, one of the modes of transmission can actually be through the nasal cavity. So if they're laying on their ear and they put their nose in it, yuck, poor honeys, can get into the nasal cavity and lead to meningitis. Because don't forget, we've got those nerves that we looked at that are in the top of the nasal cavity for the olfactory nerve that have basically an open, not open, but, somewhat open environment into the brain. Obviously, this would cause ear pain. You would see the exudate, the redness, and they'd have a feeling of fullness in the ear. So let's practice some of these really gross infections. Probably see them a lot. And this one, oh, it makes my eyes, I can't even look at it. You know what it is. It's conjunctivitis. So, oh, yuck, yuck, yuck. I hate that one. Let's move on. Bread and butter stuff. Here's normal tympanic membrane. You're like, I got that, right? You didn't see the conolite, etc. Nice definition in it. And both of these, you got it. Acute otitis media. And we've got a fusion with this one that you can see, and the one on the left is acute. You know those well. This one, now try to think, I know you know this, but try to think of the word. Okay, before you actually answer it. That's going to be otitis externa. Excellent. This one, so this is the eye, just to get you situated. It's really, really red and inflamed in the sclera. So we're actually looking at the cornea, where I've got the pointer. I think the pointer highlights yellow. That is going to be, try to think of the word, keratitis. Yeah. Now, you're like, I got this one. That's the tubes, right? So, okay. Excellent. Fun one. Probably very familiar, right? So chronic sensory disorders. So these are kind of bread and butter stuff. So I'm going to move quickly, but once again, if you have any questions, you just let me know. We're going to go over glaucoma, cataracts, macular degeneration. We're going to go over otosclerosis and Meniere's disease. So glaucoma, we know, is the grouping of eye conditions that will retain fluid in the eye. So we have aqueous humor and vitreous humor. Vitreous humor is the gel that doesn't go away. It stays the same in that posterior compartment of the eye. Aqueous humor actually will be created in what's called the choroid body. You don't need to know that necessarily, but it's created in the eye, circulates through the eye, and then it actually leaves the eye by what's called the canal of Schlemm. Okay, and the canal of Schlemm is, a small opening on the inside of the eye that actually will collect and get rid of that used aqueous humor. I have canal of Schlemm, I believe, in the notes at some point. You know what, I'll pop it right here for you. I'm positive I put it in the notes, but I just want to make sure. So canal of Schlemm drains aqueous humor. So the canal of Schlemm could just get blocked, and it obviously will back that aqueous humor up. It'll increase intraocular pressure, which the damage for that is it pushes back on the optic nerve. Once again, nerves do not like pressure. If it pushes on the optic nerve for too long, it can damage the optic nerve and you can lose your eyesight. It's the second leading cause of blindness next to diabetic retinopathy. Man, diabetes is formidable. Diabetes is so damaging on so many levels. And here we are once again, where we can have in diabetes damage to the retina. So treatment is absolutely necessary. And this is why they do that little eye pressure test. They can either do that puff of air that somehow rebounds and they test the pressure in the eye, or they can actually put a little tool to measure the pressure right on the eye itself. I think they actually have to put it on the cornea. So there's different types of glaucoma. There's open angle, which is known as chronic, and it's chronic because it's slow progressing. And so usually this will be familial, and people who have a family history of it have to be checked with that pressure sensor more often. So it can be a little more insidious and slow growing. They may think it's another issue causing a little loss of vision. And it can actually manifest as presbyopia or farsightedness as we get older. This is different from closed angle glaucoma, which is acute, which is a medical emergency, and it's a stunted blockage of that canal of Schlemm, and the aqueous humor gets blocked into the eye. So this could be some sort of trauma to the eye, sudden pupil dilation, because where the pupil and the iris is, they're actually right in line with the area where you drain the aqueous humor. So, and then prolonged pupil dilation. So if you have your eyes dilated, and they're dilated for too long, you can actually have damage to that canal of Schlemm and have acute closing of glaucoma. So this is typically unilateral because of some trauma, as opposed to that familial open angle, which is chronic and slow going. Because this is traumatic, it'll usually be one-sided. So sudden and severe eye pain, non-reactive pupil, haziness of the cornea, vision changes. With all of those manifestations, guys, I won't, it'll apply in general to the condition. I know they list a whole bunch of manifestations. I'll keep it to things that are really obvious for those conditions once again. Congenital glaucoma can actually happen at birth. So there's some abnormal development of that canal of Schlemm, and it can actually be genetic. So this has a recessive hereditary pattern. Can be unnoticed for a few months because little babies don't even seem to focus for a little while anyway. But they may have excessive lacrimation, which means a large production of tears and sensitivity to light. There might be a little swelling on their cornea or a gray-white appearance to that cornea, an enlarged eye globe, and some vision deficits. So I would think those actual anatomical presentations would be more obvious initially than the loss of vision. Secondary glaucoma is going to be something caused by glaucoma caused by something else. So result of medications, an eye disease such as nearsightedness or uveitis, which is an infection of the uvea, which is the retina. Which is the choroid, and systemic diseases such as hardening of the arteries, or once again, diabetes. Pick diabetes if you're not sure ever. Okay, here's a picture. You don't need to know this exactly. If you can sort of, I'm trying to decide how much I want to show you this. Okay, so we're looking at an eye as if you did a horizontal plane and cut the eye into top and bottom, right? Here's the cornea, here's your lens, and then the retina and whatnot are back here, okay? And right here is the ciliary body. This is where aqueous humor is created. And then the aqueous humor goes through the whole anterior and posterior segments of the eye. Once it's used up, it will then come to this little canal of Schlemm. Okay, and that canal of Schlemm is actually, actually runs, let's just say in the front compartment of the eye to keep it simple, because where it runs is a little confusing. And then the aqueous humor drains into it. You don't even need to know the location. Let's get real here. You need to know that aqueous humor is going to be formed in the ciliary body, and it's drained in the canal of Schlemm. Okay? The canal of Schlemm can get blocked. Okay? And don't worry about the trabecular network. So the canal of Schlemm decreases its absorption of the aqueous humor in this chronic or open angle glaucoma, and in the acute, it gets blocked. So with a chronic, it's a slow blockage of this canal, as opposed to acute, where you've got that trauma somewhat to the eye in that region, and it causes a real high intraocular pressure. The other thing with chronic, because it's slow going, it's not going to be as high as this acute. Now, cataracts. Cataracts are going to be a clouding of the lens, not the cornea. This can be congenital. This quite often develops as we get older. This is why we have people get lens replacements. So it happens due to family history. As we get older, the cataract, or the lens itself, I should say, oxidizes and gets older. If you ever dissected a cow's eye, their lens oxidized. Once you pull it out of the body, it doesn't have fresh aqueous humor providing nutrients to it, so it actually dies off. As we get older, the lens isn't as responsive to those nutrients. It's called oxidation. It damages and it starts to get cloudy. Smoking will perpetuate this, as well as exposure to UV light. So you want to make sure that you have sunglasses that block UV light. May affect one, I think more often it's in both. Or maybe they just diagnose it in both so you can get both your lenses replaced. One or the other. Okay, cloudy, fuzzy, filmy vision. As you imagine, there's going to be color intensity loss. You may have diplopia or double vision, impaired night vision, halos around lights, photosensitivity, frequent changes in eyeglasses or contact lens prescription. Anything that shows an inhibition of vision. So we're going to have a question time, then we're going to take a little break. Question time. Acute closed angle glaucoma is not a medical emergency. Answer that, true or false, as always and forever. If you have any questions, let me know. I will see you in the last video for chapter 14.